So Teresa was told that she has lattice degeneration, and she also sees floaters and wants to know if the lattice degeneration is treated, will that do anything for the floaters? Let's talk about it. Hi, my name is Zach Oakey. I'm a retina specialist here in Irvine, California. I'm presented with this question every once in a while. If someone is seeing floaters in their vision and we find something in the retina that needs to be treated with something like laser, what will that do for the floaters? Will they get better because of the laser? Will they go away? Will they still stay there? Well, the short answer to this question is basically the laser will do nothing for the floaters. And the reason why comes from an understanding of the anatomy of the eye. You see, on the inside of the eye, the thing that causes floaters is this big ball of gel that fills the back of the eye called the vitreous. The vitreous gel is made mostly out of water. About 2% of it is made out of connective tissue proteins, things like collagen, elastin, hyaluronin, fibrillin, etc. And these things, over the course of years, they begin to aggregate and clump together, and then when light goes into the eye, they can cast a shadow, and you and I interpret that as floaters. There can also be a specific event called a posterior vitreous detachment, in which the gel glued to the lens and the retina separates away from the retina, and in that case that can be potentially vision threatening if the gel pulls on the retina, creates a retinal tear, and therefore a retinal detachment. Now, when someone undergoes a laser procedure, then what's happening is the ophthalmologist, the retina specialist, is looking inside of the eye and they're seeing a problem on the surface of the retina. They look right through the gel. The laser is out of focus in the gel and in focus on the retina. And the intention of performing a laser, at least in this case, is to apply small, tiny little burning marks or spot welds right on that area of thinning, so that eventually, if the gel, the vitreous, pulls on that area, then it will not tear, will not lead to a retinal detachment. And the vitreous gel is basically undisturbed. It really doesn't even feel anything at all. It just sits there. Now, people can come away with the impression after they have a laser procedure that the floaters are better. But people can also have the same feeling if they just live long enough. Floaters come and go, and the reason why we perceive that they're there and then they're not there is because vision really occurs in one tiny little place in the back of the eye, a place we call the macula. And so if there's a opacity or an imperfection in the gel and it floats away from the macula and is not casting a shadow there, then we come away with the impression that the floater is gone. It's not really gone. It's in a different part of the eye, casting a shadow elsewhere that the brain is not really paying attention to. And then if you continue to kind of jiggle the head, move it around, etc., then eventually you'll notice that the floater comes back again. You'll say, oh, it's back. And you might actually say, oh, I was doing this thing, I was taking this medication, I was doing whatever it is, and that's what brought the floaters back. You may even come away with the impression that that thing that I just did causes floaters, when in fact it would have happened anyway, maybe even under different circumstances. Now, there are laser procedures that can be done to remove floaters. This is a different kind of laser. The kind of laser I'm referring to that removes floaters is something called YAG laser. And if I'm being fully honest, it's not something I really ever recommend, especially for people who have the natural lens still inside of the eye, or if the floaters are really close to the retina or the optic nerve, because that laser can be harmful to the lens, to the retina, and the optic nerve. Really, the only best solution for floaters is to ask ourselves, number one, where do they come from, so we can treat the cause. If it's just the gel inside of the eye changing over the course of time, then my recommendation is just to live with them. But if there's so many, they're such a bother, then technically one could do a vitrectomy surgery and remove the gel from the eye. But this is a pretty aggressive step, and it's not something that I recommend for probably 98-99% of patients. We really only reserve it for people who are really severely impacted by these floaters. And even then, I still like to inform people, if they haven't had a lens replacement or a cataract surgery, that they're going to get a cataract if we do it, and then also that there's a risk of retinal tears, retinal detachments, all sorts of things. So it's really reserved for specific people who have very specific and annoying symptoms.